Okay, here we see floating infected particles, and here a real very abundant leukoplakia tissues. In most of the countries other than United States and UK, we see these abundant tissues. These people do not treat it with long-term antibiotics too much. My main theory is that using too much antibiotics heal these tissues, at least the superficial part, but they change the bladder flora and bladder walls, and all the bladder walls are inflamed. In this case, although there is a big leukoplakia here, there is no infection in this opposite bladder wall, no inflammation. It's not disseminated. Yes, at the end of the procedure, we will understand better how much the side walls, bladder walls will be affected, but until now it seems quite alright. Okay. Okay, now I can see the left ureteric orifice, and these are some leukoplakia here. I will mark the borders here. I want to do it a little wider. Here I can also differentiate the leukoplakias. Okay, we can see some leukoplakia tissues very close to orifices. I really hesitate to make fulguration near to orifice, but we have to do some. This border is good enough. And this is a normal bladder tissue here. I come back. Okay, here, look at this. We can see the border here. Normal tissue, abnormal tissue. I am marking the border. Here, very tiny sections.
Evet hocam.
Abnormal, here normal. In this case, it's really easily differentiated, very well seen. And in the bladder neck, I can see tissues here. This is my border. This is urethra. It seems normal. Look at all this triangle beautiful way. And the upper part is also important part. In ultrasonographic view, we see some differences here, and although it's not very recognizable with endoscopic view, I am fulgurating these parts. I don't want to leave any suspicious tissue behind. Okay, now we are fulgurating these parts. Look, when I do the fulguration, this tissue layer, abnormal tissues, come off. When there is a bleeding, we have to coagulate the bleeding. Yeah. Yes, we are nicely and slowly filling in the empty spaces. We are connecting the dots and try not to leave any part. Okay, you see, I want to fulgurate all these parts. And there are when you come to bladder neck, it's always like a horror movie. Too much. Biraz daha. Okay, we come to last part. This is the bladder neck. And we do fulguration slowly. We have to clean these tissues deep enough. Okay, now we are about to come to the end. This is our limit here. Okay, now we come to an end. This is retro normal, and then we look at the trigone. We fulgurated all the abnormal tissues in the trigone, and I really hope a really very nice recovery for this patient. And here in the back wall, I did some fulgurations, some tissues. Look at this tissue; it's little inflamed. It's not like here. Look at this part, different, this part different. So here I do some spots of fulguration, and I let some tissue healing. Look at the abnormal vasculature. So these spots, other than that, the bladder walls all seem normal. There is no bleeding, no fragility in the bladder wall. So I hope a real good recovery for this patient. Okay, it looks very nice, nicely fulgurated. I'm now will look to the vaginal part. This is cervix uteri. I can see there is a little too much inflammation, but okay, it's not. I'm sure gynecologists will not consider this as too much, but yeah, I see some clear tissue changes here, and I will recommend her a gynecological consultation, of course. So, okay, I can't say this is a totally normal cervix uteri. There are some quite significant tissue changes, so we better ask to a gynecologist if it is normal or not, if it needs treatment or not. Okay.